We are going to shift gears and talk about your health right now. Many people are noticing their eyes more as they wear masks and have more time on screens, and some people have a dysfunction within the muscle of the eyelid. Let's find out more.
Right now, I have the opportunity to speak with Dr. Raymond Douglas about droopy eyelids. This is actually a problem with a muscle in the eye, and it's a condition called ptosis. Thank you so much, Dr. Douglas, for joining us today.
Thank you so much.
So tell me more about what ptosis is and how it works.
Yeah, so ptosis is when your eyelids, your upper eyelids, begin to droop. And this is often due to the muscle that raises the eyelid becomes a little stretched from the eyelid or becomes a little weaker. And you often notice this just because when you're driving, you have to strain a little bit more to raise your eyelids, or you might notice on photos or in video, working on video as we all are these days.
And tell me more about a treatment for this and how it works.
Well, because the muscle kind of stretches out, we've in the past only had surgical treatments and where we had to go in and actually shorten the muscle and do a little surgery. There is a new FDA approved treatment. It's an eye drop that elevates the eyelid by actually contracting the muscle in the eyelid. You put one drop in per day, and then it lifts and elevates the eyelid in as short as 5 minutes in one study, but definitely over the next couple hours.
That's incredible. So who should get this treatment, and who's a good candidate? Who's the ideal patient for this?
Well, ptosis can occur at really any age. And this is approved for anyone who's had acquired ptosis as an adult. So you want to definitely consult your eye care professional to make sure this is not due to some medical condition. But really anyone who is an adult who's noticed drooping or low-lying eyelids is really eligible for this drop and can take it, and it's been shown to elevate the eyelids in a variety of patients.
And you mentioned that in the past, one of the only treatments was surgery. So is this a viable alternative to the invasive and expensive eyelid surgeries? And can you use this after using more invasive or surgical procedures if those didn't work the way you wanted them to?
Yeah, so great question. So this really is the first medical option compared to surgery because it elevates the eyelid just the same as it's very similar to surgical procedures. And so certainly this can be used, daily. And some patients have noticed a little irritation, but most find it very comfortable to use on a daily basis. And anyone who's had acquired ptosis, even if you've had other procedures that have elevated the eyelids, but still their low-lying eyelids are eligible to use this drop, and it may, cause further improvement of the eyelid height.
And are there any warnings or precautions that we need to know about?
Well, ptosis can be caused by medical conditions, so definitely want to consult with your eye care professional and make sure that the droopiness that you're seeing is not due to some other cause. Also, most patients found the drop very comfortable, but it can increase the blood pressure. It has to be used in caution with some patients, especially if they have narrow angle glaucoma or blood pressure issues. But your eye care professional can really help guide that and make this available for you by prescription and make sure that those warnings are heeded.
And where can we get more information?
The easiest place is upneeq.com, and that's upneeq.com.
Well, thank you so much, Dr. Raymond Douglas, for joining us here today to tell us more about ptosis and some new treatments for it. We appreciate this.
Thank you so much.